When a patient presents to our clinic with an oral lesion, we perform biopsy. If the biopsy comes out to be a pre-malignant condition, what do we do next? Do we have predictable answers for the patient's concern about cancer? Proteocyte AI offers some predictable resources that we can offer to our patients and their treatment planning.
Oral cancer is the sixth most common type of cancer globally, with nearly 500,000 new cases reported annually. Most people are familiar with malignant melanoma and pancreatic cancer, despite oral cancer being just as prevalent in North America. Oral cancer claims 50,000 lives per year alone in North America. Early detection is the most critical element in managing oral cancer, but unfortunately, 75% of patients present in the advanced stage, resulting in poor 5-year survival rates of 50 to 65%. These survival rates have not changed in the last 50 years, primarily due to our inability to identify high-risk patients and intervene early. Effective screening, awareness, patient education, and more importantly, the ability to utilize biomarkers to identify high-risk patients is key in the advancement to increase the 5-year survival rates. Biomarker technology has not been available until now. With the recent release of the new Stratasite Advanced Diagnostic Lab Test from Proteocyte AI, we welcome leading experts in the detection and treatment of oral cancer to discuss these challenges with the current standard of care, along with fresh management strategies for managing OPMD patients and the new Stratasite Advanced Diagnostic Lab Test from Proteocyte AI. Dr. James Melville is an oral and maxillofacial surgeon and associate professor, Department of Oral and Maxillofacial Surgery at the University of Texas Health Sciences Center in Houston. Dr. Barry Rennick is a practicing oral and maxillofacial surgeon based in Toronto, Canada. He is also the Chief Medical Officer for Proteocyte AI in Canada.
Oral cancer is a common and deadly disease and continues to increase in incidence globally, with an alarming new demographic swing affecting patients under the age of 40 that are both non-smokers and non-drinkers. This is in large part due to a recent surge in the human papillomavirus.
While there have been significant advances in the treatment of oral cancer, the 5-year overall survival rate has shown little improvement over the past few decades, and at rest an embarrassing overall rate of 50 to 65% in Western society, and less than 20% in many other regions.
In the US, one person dies from oral cancer every 45 minutes. The majority of oral cancers develop from a precursor lesion called oral potentially malignant disease, or OPMD.
As clinicians, we are failing our oral cancer patients because of our historical inability to reliably recognize and effectively manage the patient with oral precancer or OPMD.
If we can correctly identify the at-risk patients, we may be able to either surgically intervene in their OPMD before cancer has a chance to develop, or at the very least, we'll discover their cancer at the earliest stages of microinvasion.
Public education, mass screening programs, and dysplasia grading have done little to reduce the significant morbidity, mortality, and economic costs of this disease.
How can we better serve the OPMD patient? What is the solution? Well, we do have one, finally, and it's called the Stratasite test. The new Stratasite test, a cancer biomarker-based advanced diagnostic lab test from Proteocyte AI in Toronto, Canada, might be the biggest advancement in managing the OPMD patient in many years.
The Straticyte test is simple to order and seamlessly integrate into any practice. You order the test and Proteocyte does the rest. The Straticyte test uses tissue from the patient's original OPMD biopsy. There is no need for another biopsy. Microscopic slides are prepared from the original tissue. They are stained for S100A7, a biomarker associated with many cancers.
After this, the microscopic fields are digitized. The Straticyte test uses proprietary AI-assisted technology to perform two functions. Cellular morphometrics on the tissue are assessed, and cellular S100A7 protein is quantified.
The test results are compared to large cohorts of OPMD patients, followed for many years with known outcomes, to generate personalized and individual 5-year oral cancer risk. The test is totally objective, removing any element of subjective speculation and dysplasia grading. In recent multi-center study over 302 patients, Straticyte had a sensitivity of 97% and an NPV of 97%. Only 3% of the patients were on to develop oral cancers were assessed as low risk.
These results exceed most of the MAAA cancer predictive tests on the market today, such as MammaPrint, EndoPredict, and Afirma.
Straticyte is now commercially available for use in both the US and Canada and has been used over 1,000 patients. Straticyte is currently being used in practice at leading oral cancer treatment centers in the US, such as the University of Alabama, the University of Minnesota, and here at the University of Texas, Houston.
I would like to thank Proteocyte AI for offering this video. Mark your calendars for April 4th at 7 p.m. Eastern Time as AOM teams up with Proteocyte AI to host an interactive webinar, a lively discussion you won't want to miss. I extend my heartfelt thanks to Proteocyte AI for their generous support as Platinum sponsor of our upcoming annual conference at Hyatt Grand Cypress, taking place from April 17th to 20th. Don't forget to visit their booth to explore their offerings and join us for a special Lunch and Learn product theater session on April 20th. Remember, seating is limited to just 50 attendees, so be sure to arrive early to secure your spot.